My name is Luis Stern. I am homeopathic in Brazil for 33 years. I would present the two works I'm currently studying and research very hard with love and dedication. Classical approach of John Schoute method, cancer scope and limits. I hope you enjoy and be useful to help relieve the suffering of their patients. Thank you very much. Cancer scope and limits of homeopathic treatment. Although many people don't know, homeopathy can be used in the treatment of cancer. It can be used as primary treatment or as palliative treatment, or as a complementary treatment with allopathic medicine. It can be used pre- and post-operative situation. It gives the patient quality of life as he learns how to deal with death. It can also help in case of depressions and panic syndrome. It can also treat advanced cases with recurrence and advanced cases with multiple complications of surgery, chemotherapy, and radiotherapy. What results can you really expect when treating a patient with cancer? Homeopathic is able to treat patients with precancerous conditions with affinity to cancer, cancer cases with primary localization or multiple metastases. Here you have important medicals homeopathic and their books. Samuel Hahnemann, Jan Schulte, Ranjan Sankara, Alok Parekh, Ramakrishnan, Prasanta e Pratik Banerjee. Homeopathic, it is mission. The physician's high and only mission is to restore the sick to health, to cure as it is termed. Homeopathic has been used for more than 200 years. It is a low-cost and preventive treatment. Homeopathy is safe, has no contraindication, is effective and fast. It presents no side effects. Homeopathy will study the patient's personality and character, his fears and also his food preference. In order to keep his vital energy, the homeopath will advise the patient to avoid sedentariness and a poor diet, to avoid smoking and drink alcohol. It is important to keep the balance between death and life impulse. Here, I will now tell you about a case I had in my clinic. Mrs. Ree is a 15 years old woman, very insecure, full of fears. She is a shopkeeper, is married, and has 2 children. The treatment began in 1993. She had many complaints: early menopause, head flash, insomnia, stress, frequent colds, even pneumonia. She was very anxious. If she had children very late, she always thought that something terrible has happened to them. She was perfectionist. She had many sleep problems and used to dream of dead relatives. She was very scared of dying. She was worried about the future, about her financial security, about missing her mother, her children, her family. She was afraid of having cancer, and there were many cases of the disease in her family. She loves to eat bread and drink coffee, and is very sensitive to weather changes. She started homeopathic treatment with calcária carbônica 2-LM, involving to 10-LM, with improvement of the overall picture, but the asthma attacks persisted. Also sinusite and lot of preoccupation with family and guilt in the case of not fully reduced. The remedy was changed to arsenic alb 2-LM globules with no worse to asthma attacks, anxiety and guilt. 40 years ago she had a rectal cancer, and due to her fears of death, her concerns about the future and how her family would get without her, I changed the medication to calcária arsenicosa 2-LM globules, 2 globes twice a day. There was satisfactory physical and mental evaluation. Currently she is taking 15-LM. Great reduction of fears and physical complaints, anguish and ghost. She could go through the cancer period stronger and more balanced. You can see some pictures of the patient's cancer.